Hello and welcome. My name is Allison Ban, and I'm the Executive Director of CRESS, the Center for Research in Empirical Social Sciences, which as of January 1st will be officially renamed SPARK, a Center for Social Research Innovation. I'd like us to begin by giving honor and thanks to the Haudenosaunee and Anishinaabe nations as the traditional inhabitants of the lands where McMaster stands. To say that is to acknowledge a debt to those who were here before us and to recognize our responsibility as guests to respect and honor the intimate relationship Indigenous peoples have to this land. This series, Relevant Research, is hosted by the Sherman Center for Digital Scholarship and CRESS/SPARK with a generous funding from SSHRC, the Social Sciences and Humanities Research Council. Dr. Brian Southwell is joining us again from North Carolina, where he is a busy man. He's Senior Director of the Science in the Public Sphere program in the Center for Communication Science at RTI International, and teaches at both Duke University and the University of North Carolina, as well as actively working to increase public understanding of science in multiple ways, including an excellent radio show and podcast called The Measure of Everyday Life, which I encourage you to check out on the podcast catcher of your choice. Thank you so much for joining us again, Brian.
Great, thank you. It's really a pleasure to be here. And Allison, I also want to thank you for the invitation to come back for a part two of this workshop. Sometimes I'll be out talking to people, and it'll be a great conversation with a large audience, but it's sort of a one-time engagement, and this offers an opportunity to follow up in a way that I really appreciate. So we have planned today. For those of you, I think just everybody here was here last time, is really going to be an interactive follow-up. This is going to be contingent on your ideas, and I'm going to offer some real-time advice with regards to that. You're also going to have a chance to talk to each other a little bit about some of your ideas. For those of you that are interested in a rehash, or if there's anybody on the call right now that didn't see the first session, Allison has that video available, and there are other resources where you can find some of those ideas. That if you follow up with me, I'd be happy to share those with you. Also, I had one question come in regarding that radio show that Allison mentioned. If you're interested, certainly do look in your favorite podcast app. You can also find our direct syndicated site at measureradio.libsyn.com. It's Measure Radio, all one word, .libsyn.com. It's where an archive of about 6 years of our shows are. You can download it from there too, if you're interested. And I really have been looking forward to today. We heard a little bit of this last time in terms of some of the ideas that you all are bringing to the table, or that you might be bringing to the table in the future. What I wanted to do today was have you think about that question I left you with last time, which is, in a minute or so, can you articulate how it is that some aspect of your research is relevant to an emergent or a current problem that we're facing in society, and to some aspect of today's headlines. And that was really just I think, an opportunity for you to put some ideas together that we can then build on, and to talk about either how you might reframe that a little bit, or potentially some angle of that work which actually might lend itself to further promotion or translation of your work into helping to build knowledge, or there might be opportunities to think about just concretely what are partnerships you might pursue, what are media outlets you might pursue. And so with the group that we have here, I want to hear from everybody as a whole group, and we're going to do that. But I first wanted us to break into smaller groups, and so we'll do this randomly. Maybe it's a chance for you to talk to a couple of colleagues that you know very well, but it might be a chance to talk to some different people. Don't worry if you're working with people that are in wildly different fields. That's actually part of the point here, is to kind of talk about potential connections you might make, or hear how your ideas come across to somebody else. So for about 10 minutes or so, Cheryl has offered to break you all into work groups, and then we're going to come back. And then when we come back, we're going to work with the full group here that we've got. And I'd like for each person to, at the very least, turn your microphone on, and if you want to turn your video on too, and you can join us to just give essentially a minute or two overview of how you think your work might be relevant in the public sphere. And then what I'm going to do, I don't want to offer this from any great sense of hubris, but just in terms of practically offer some ideas that I might have, and in terms of connections, but also you're going to hear this happen for everybody else that's on the call. So there's a lot of learning from each other. And my thought about this second day was this is an opportunity to further follow up with you all, but also to really encourage this as a McMaster effort. And a chance to kind of connect different parts here. So there might well be collaborations with Allison's group, that turn out to be useful. And if this surfaces some of that, that's great too. So in any event, just more an open-ended follow-up day, and a chance to get to know each of you a little bit better. And it's been a wonderful introduction to McMaster, thus far. So I really appreciate that. So with that in mind, Cheryl, if you want to invite people to rooms, your charge is for each of you to quickly mention and to spell out what you think so the relevance of your work is to today's concerns in some direct way. You may not feel very comfortable doing that. It may not go very well, and that's okay. We're doing that to start to practice that here, but also to get some feedback. I am going to also ask, as people offer that feedback, that you are both honest and direct. That's respectful to do that, but also recognize that you're talking about somebody's work in a way that is important to not be so cavalier and callous as to say, well, that I don't see what you're talking about at all. So some gentleness there is useful, but candor, I think, is really helpful. So we're going to see that theme all throughout today. None of this is a matter of the academic respect that we all can have for the individualized work that people do. We're really just talking about now and kind of moving this over and translating it. Here's some practical ideas. So let's not take any of this personally in terms of the ultimate intellectual contribution in your particular field, but this is really about translating it, some practical ideas, and it's not going to cut to the heart of what you're all about in terms of your intellectual pursuit per se. So I think it's important to just keep that in mind as we're critiquing each other, if you will. So let's go ahead, Cheryl, and move people into those groups. We'll come back here about 10 of or so, and then we'll kind of move to a more discussion of the whole with everybody. Great. Okay. Well, welcome back to everybody. It sounds like there's some great conversations happening already, in the breakout rooms, and that's fantastic. Even though you all are from an array of different disciplinary areas, something that's great about workshops like this and events like this is that you're already likely in alignment with people that are interested and at a similar stage of trying to do more translational work. And so that commonality, I think, is going to come out, and we're going to see more of that in the discussion today. And to be perfectly honest, part of the thought in terms of this follow-up, it's great for me to give you feedback, but it's also to make sure that there aren't ships passing in the night, people that could actually be connected at McMaster who otherwise wouldn't have connected. So this sounds like it's already starting to serve that purpose. And I hope that, if for some reason you've got an opportunity here now, also feel free to chat each other privately or to exchange information or other things, or just make sure that you're taking down, first and last name of that great person who had that great comment, here. So what I wanted to do today, I know this runs the risk of, I don't want any of my advice to seem, pedantic, or to, again, to suggest that everything's centered around, my perspective, at all. But what I wanted to do, and I've done this before, and it turns out, I think, to work really well, is just to work through, each of the ideas that you all are bringing. We've got a good number, to do this in the time left that we have. We all have different algorithms, kind of driving who's on screen in what order. I don't know which box I'm on in your screen, but I've got a certain array here, so I'm going to go through that and call on people if that's okay. And if you're not in a position that you really want the wider group to to kind of talk about or kind of go through that, it's okay. You can certainly pass for now, or maybe you've already had your fill in the workshop or in the breakout room. But otherwise, what I thought you could do is, most of the people here on the call have not heard how you just articulated your particular angle, and so I'd like you to restate that. I'm going to offer some ideas, and then also to kind of build on that, we'll leave the door open. Here's another opportunity for us to also kind of liberally use the chat as well. And so because I want to get to everybody, I want to do this and offer a couple of thoughts and feedback. But as you're hearing somebody else talk, you might, think, actually, you really ought to talk to my colleague, at this other university, or actually this journalist, or this, type. Please put that in the chat, and you can just direct that at that person. And then at the end, I'm going to leave enough time, 5 minutes or so that you can all kind of scan through the chat and see, when I was talking, actually, Kelly or Alicia or Allison, had these great comments, for me, and they were here in the chat as well. So again, just sort of trying to structurally kind of provide some more networking that way. So Teresa, I don't know if you're happy about this or not, but you're up first on my screen here. So if you don't mind, it'd be great to hear just a minute, from you as to your sense of what some things you're working on currently, how those are relevant, and then we'll talk a little bit more about that.
For sure. So there are two research projects that I'm involved in right now that are somewhat speaking to one another. One is funded through SSHRC, and the other is funded through the Mental Health Commission of Canada. And so both of them are looking to understand women's consumption of cannabis in a legal framework, and really from a strengths-based perspective, understanding the intentionality behind cannabis consumption as a mom and as a parent. And the relevance is we've not had this opportunity to look at women's consumption of cannabis because it has been criminalized up until now. So we had only understood it from, a criminal perspective or a medical cannabis perspective. And so both research projects are, interviewing women for their understanding and their knowledge. One's using an arts-based perspective and the other is using deliberative dialogue. And so where the Mental Health Coalition research is sort of extending is it's taking the knowledge and information that's gathered and then looking to understand from sort of an intersectional perspective, how do healthcare workers or child protection workers or mental health workers understand cannabis consumption, and as it relates to women who are either pregnant or parenting. And how do we have a conversation that maybe takes some of the intentional consumption understandings from women and childcare workers on the other side and creates a toolkit where, we are shifting that dialogue, the stigma that may have been attached to it or the mental models that had previously existed,
yeah, right.
Are presented a little bit differently with that, more knowledge that's been mobilized. So
it sounds great. So, now some of what you're doing may or may not be, directly related to anecdotes or stories, from the pandemic, but, there's an angle there in terms of, there's this opportunity for us all to kind of reevaluate, how we're getting by or kind of, that framework. The notion of empathy, for these different perspectives, strikes me as really important for you to kind of draw out. You think about some of what you've done is pulled together and done legwork for, there's a long form journalism piece in terms of these stories of women, triumphantly and otherwise, kind of using this to kind of balance their lives that packaging and talking about, this, it's a treasure trove. Actually, I can think about, this being basis for a Rolling Stone article or, Atlantic article or something like that. And it might be worth, kind of reaching out, to both serve as intermediary, but I don't know, there's an ethical aspect of that, too, in terms of how much you could also think about how you've drawn upon, those experiences. I'd pay close attention to not only journalists who are writing about the policy evolution of this, but people that are in that space of kind of those stories. Again, that's what kind of my mind goes to the pandemic of there's been a lot of work on alcohol use during the pandemic and other things that are from the frame of like, what are people doing to kind of manage this? So in that sort of mental health space. Also think about, women's health magazines or other, angles there that, and I think just making sure you're connected to some of those people on LinkedIn would be useful. Making sure that you're putting some of those and you're reflecting on and posting about that. There's some keywords there that make that work really sort of inherently, interesting. I think it's going to be partly about sharing those stories. I think that's going to be, the really interesting part of it. You have a very nuanced, I'm sure, perspective on what the implications of that are for for policy, and getting into the intricacies of that will be useful for some audiences. But I think initially it's more a matter of normalizing or destigmatizing anyway the considerations there. And you might be able to connect that. There's been a lot of talk in the U.S. As different states have kind of evolved in their own perspective on marijuana use, and think about folks that have covered some of that, and so yeah, I think kind of reaching out, certainly letting there's angles. I'm not sure, just in terms of McMaster, newsrooms and the information group. Just make sure that they're aware of the fact that you're would be a great source, and making sure that they're available to pitch you, per se. So we can definitely come back, but there's some initial ideas, and that was a great summary, and hopefully some others have suggested some things too. So what I'm going to try to do is kind of quick go around to everybody that way, and then we're going to see where we are as kind of a discussion of the whole. But Teresa, that was a great start, and there's a lot in your work that I think we'll likely see further light of day soon. So great. Okay, Allison Ian is actually up next.
Yeah, so actually I'm going to build on what Teresa just said, because we are partners on this research program of research. And I guess Teresa, I really loved what you said. And I guess if I was going to add something or think about a different kind of audience, something that I was reflecting upon in doing this homework was how, what we're actually really wanting to do is address a problem where cannabis consumption is viewed as a biomedical or a social risk, and how this actually gets taken up in child welfare work, in terms of risk to the fetus, infant, or child, without actually considering kind of the broader context in which these pregnant individuals or parents are consuming cannabis. And so we actually hope that this work will result in more meaningful, supportive, and holistic conversations that are happening during prenatal appointments, but also preventing actually intervention in families of child welfare, and having a file be opened because of cannabis consumption. So that's just something I wanted to add, maybe to what, in terms of speaking to child welfare. Yep.
No, I think that's great. So there's two things that actually this further suggests. I think it would be really interesting for you. There are increasingly in sort of the academic medical arena, there are these adjacent podcasts and other sort of vehicles. Just recently I did a long interview with JAMA. JAMA has a medical news podcast, and they wanted to talk about misinformation, and I spent some time talking with them, and I think pitching to and actually starting this, because part of your conversation is actually around reaching clinicians potentially, or reaching other healthcare professionals and changing their view on this. The other thing that I would not shy away from is you both, in talking about this, really emphasize cannabis, right? But and correct me if I'm wrong on this, but actually the part of the angle here is thinking about women, and thinking about the ways that there's continued discrimination, there's continued gender thinking, that so you could actually tie this into yet another part of how both in terms of demographic shifts and in terms of all kinds of the story of the 20th 21st century that often isn't told loudly enough, is the transformative role and the really important role of women globally. And this is another angle where part of the problem has been because of certain roles or because of certain aspects of life. There's a additional burden for stigmatization here that's not fair, it's not warranted, and that is yet another reason why we've got probably some of the you talk about this in terms of labor discrimination or other, like there's an angle there that kind of tying this into yet another unexpected way where we've the things aren't equal, or something like that. That would be kind of an interesting, and so it's not necessarily just about drug use. It's really about here's another place where there's a double standard, or where there's and there are going to be there's going to be an audience, there's going to be journalists who'd be interested in that. I think writing about it, framing it that way. I think you both are. I don't know if you're in a position right now, but to be blogging about that, or kind of be putting some of those essays out there too. I think that would be really smart, in addition to the rest of the articles. Great. Okay. That's excellent. So we'll probably come back to that, but that's great. So Elaine, you're next, sort of on my screen here, if that's okay with you. Yeah.
So we know that poverty has been a problem forever in Canada, and COVID has really made visible these social class inequality. And we know that poverty most impacts, for example, women and single mothers, and this isn't changing. And we know how important education is to mitigate poverty and poverty across generations. Yet, why is it that our taxpayer-funded Canadian universities continue to deny at least 3/4 of our population an education?
Wow. So,
okay,
so
I think I'm gonna have a stroke. I don't know why my heart's racing.
Gosh, well, it's a dramatic question. So Elaine, so in your work, so you get to that dramatic figure, that statistic. So tell me more about that. Like, what's the story there?
Well, so I should just back up. We don't have statistics about who attends universities.
Okay.
And this is just our new president at our university is addressing this. Well, at least he spoke about it. And he's saying at least these many Canadians don't get access to a higher education. But we truly don't have numbers, statistics. That's one of the struggles of I can't bring in numbers to tell a story.
Yeah. Well, and it's probably worth then finding some way that you're on rock solid ground, because otherwise people might pick apart the number.
So I feel like without statistics that I have no ground to stand on. And that's one of the constant struggles that I have. So I'm not sure how to address it.
Yeah. So, but do you have any way of estimating, like, is there an at least number that you could get to there in terms of like what's the basis for it? Is this a matter of, monetary, reasons in terms of the cost of tuition? Is this a matter of structural, racism in terms of admissions? Is this a function of like what people have access? Like what's really I know there are many factors, but like what are the one or two things that are driving the biggest, barrier to entry?
When Canadian universities were created, they were created for a certain population, that is white Protestant males.
Yep.
Then they had to expand it a bit to include Anglican. And these, of course, are middle and upper class. After World War II, they opened it up a bit. And there were big debates and concerns that it was going to lower the standards of Canadian university education and cause problems with international views about Canadian education. So there is this historical foundation of Canadian universities, that they were only for a certain type of person.
Mm-hmm.
And this is part of how Canada was also colonized, is based on wanting a certain kind of person, and that is rich white people.
Mm-hmm.
So people from poverty were forced here as an indentured service or forced here to escape the horrors they come from. So this is sexism and racism and ageism and classism and ableism are all the foundations of Canadian universities. And poverty discrimination in Canada is something that legislation has failed at every time at the parliament, at our federal parliament. So this shapes all legislation, policies, procedures, ways of thinking, pedagogies, and who has access to higher education. So in Canada, the idea is that just get a student loan and then it's a level playing field. Now imagine being a single mother from poverty. You become buried alive in debt, in student loan debt. And it isn't a level playing field. So when it gets reduced just to money, it fails to understand that this culture is built and created and sustained for a certain group of people. If you come from poverty, you're expected to assimilate, and that's some sign of success.
Right.
So that wasn't in 1 minute.
No, but it goes to, so it's really, the supposed solution is around, we've got access to loans, but that still is, a really continued burden for people that, we're really missing. I can imagine the story, that comes out, which is, 100 years ago, Canadian universities were, essentially, white males, and then, and they still are, or something like that, and sort of kind of pointing a figure as to the, before, after. It'd be interesting if you're able to, kind of articulate the, the state of, Canadian education, the composition, and to, show how that hasn't really necessarily improved. I think also, if there are new initiatives that are really kind of getting at that, kind of celebrating that. I don't know what the pandemic turn has done in terms of, online, education possibilities, but, in terms of the cost model, there's some hope or possibility anyway that, that might open, doors that haven't been before, but, kind of putting a spotlight, if there's anything small that's been done, even in a pilot way, that's the story to get out, I would think, that.
Well, I'm doing that. I've been
Okay.
doing that for 4 years. So that's the story I can tell with an initiative I started. So why don't I talk about that?
That's probably where you should start then, maybe, right?
Okay.
So, right, because so we've got all this doom and gloom news.
Right.
Here, we're doing something. There's something that works, right? And so, is that initiative actually enrolled or gotten, some people, into higher education that wouldn't have been otherwise?
No, it hasn't gotten people in. What it has done is help some students survive.
Okay.
It's a grassroots community. We have no money or anything, but it's also really doing some good advocacy work of getting people engaged. It's because of this initiative that we got our new president to listen, because I rallied people to go write comments, and his online town hall said, "Oh, this is a thing."
So I would think, one thing to think about is, who the 2 or 3 sort of go to, example, beneficiaries of this program, might be, but that, kind of building a relationship with them where maybe part of what you're doing is kind of talking in partnership, with them, maybe even co-authoring an essay with somebody that's benefited from this, and then kind of talking about how that's, I mean, if there's an opportunity here marketing wise for McMaster to kind of own this space of helping people through, I think a lot of people are feeling this burden, but here's a real program that's actually helping people survive, and here's in the voice of, and it worked for me, and this is what I'm doing. That would be really compelling. And then so maybe actually seeing it, those conversations you have with people, say, hey, actually, what would you think about the 2 of us partnering on something to talk about your experiences, and then I could give the larger context to how we want to see this spread to all Canadian universities. Maybe this is the start of a larger grassroots movement, and getting that into an op-ed or an essay. I think that would be great. So
because this was the idea, is that this would spread to all Canadian universities, and I hold these monthly online webinars where we're talking about this. So I will connect with people, because there's so much stigma to poverty, so you have to be so careful with this.
I know, and it's going to be a matter of your respectful relationship with somebody too. That's great. Okay, so
thank you everybody for your comments and in the chat thingy.
Yeah, that's great. And it's really just about thinking strategically, thinking about your work in different ways, thinking about how to frame it, but also maybe some unconventional opportunities to start to kind of get the word out there, and not to assume that tomorrow a major media outlet's going to come knocking on the door, but it's a matter of building up to that and kind of getting the word out in some different ways, and to not assume that silence in terms of uptake is a lack of interest in your work, but rather sometimes it's a matter of lack of exposure from journalists or community organizers or others, and so just kind of working at that was part of the theme. So great. Okay. All right, so let's move on then to Alicia Clifford.
Hello.
Hi there.
Not a little nervous, but that's okay. So my research focuses on Indigenous women who've spent time in a federal corrections institution. So they've done hard time. They're the fastest growing demographic moving into that system today in Canada. And in the Canadian context, we have something called healing lodges. They're cultural institutions where the intention is for the women to begin their healing journeys. They can be reintegrated back into the community. They're already marginalized when they go in by their gender and their indigeneity. Then when they get out, you add on the additional stigma of being criminalized and having spent time in prison. So my research looks to assess whether or not these institutions actually provide healing, and whether the women come out becoming content, productive, and able to contribute to their respective communities. So the intent is to understand how can we actually best support them in this, because every single one of them have a story about how and why they got there. And it's important to understand that context. And so especially within the context of COVID right now, I know they're especially isolated because community organizations that used to go into the institutions can no longer go in because of COVID restrictions.
Yeah, that's great. So I want to encourage you, just so you talk about that for a minute. There are a couple of different lines, avenues to go there that are really rich. I know a lot of people feel nervous about this and feel like, all right, I need to say everything I have in the first couple of seconds, and we're going to rush through all that. Just the Healing Lodge notion alone is very compelling, as sort of as a, and so that's something that I can imagine, introducing, bringing somebody into that, as you talk about it on the radio or other places, even just describing what that's like, as a place, that'll be really rich and useful. I suspect other people on the call, here, I only gave you a minute, and you're not often going to get a lot more than that. But imagine you had 5 to take the same amount of content and just kind of stretch that out a little bit. When you get a chance to talk about it, there's being imprisoned, facing lifelong stigma, the notion of there being a healing place, all those are very weighty ideas. And if you give people a second to just imagine that, because some of your people that you're talking to or others aren't going to have had that experience, there's a lot of gravity in that. And this might sound like weird advice, but I think this, if you can slow down with some of those ideas and just sort of lean into that, there's a lot there that's really powerful, and that's gonna kind of go on. And so I don't know now in terms of current media attention, or has this been something you've had a chance to kind of translate or talk to people about at all? Okay, so I think there's a lot of potential there. I think that the notion of and I think keeping you might be skeptical or excited about the Healing Lodge. So, from an evaluation standpoint, you have to be objective and ask questions about it. But I think that in terms of imagination is going to draw a lot of people in, especially the parallel, to the physical space of being imprisoned and the physical space of being in a more of a healing place. It's something that duality is really interesting, there too. So I think part of it is just getting people curious. You could even draw on the concept. It may or may not be yours, per se, but still, an essay or what is a Healing Lodge? And is this something that, we all could benefit from, or that we might reconceptualize as we're rethinking, how we re-envision living in cities or envision living in spaces. All of us, we're kind of had this new relationship to the spaces that we put together for societal well-being. Here's an example of how we're helping people come from this difficult circumstances, but is this something that might also benefit the rest of us? So city and regional planning or other, there's just different conversations you could get maybe a part of there. So I think there's a lot in that. I think in your case, the question ultimately, there's a policy level question of is this useful, and I think that's important. But I don't think you should overlook the importance of just introducing some people are going to want to talk to you about the experience of being in prison. Some people want to talk about the experience of these healing lodges, and just unpacking and kind of providing those. That's going to be useful to a journalist. It might be useful to different audiences. It might be useful. I can imagine the almost TED Talk, that you extrapolate from this into what the implications of this are for how we think about helping each other and reconcile and relate to truth and reconciliation commissions in Africa. There's all kinds of ways that this is there's a deep, long-seated idea here as to how we might help each other that we could bring forward into the 21st century. So yeah, there's a lot in that. So so have confidence in it, and yeah, we can talk more. I just want to make sure I get to other people too, but that's great. Okay. All right, so let's go to Caitlin next.
Hi, so I'm not actually in McMaster, so I feel terrible with the...
I'm not either, so that's fine.
Okay. So what I've been working on that I think would be worthwhile talking now is a Canadian-Icelandic American collaboration project that we've been working on since 2015. Because about 130 years ago, about 20% of the Icelandic population left for North America. And it was a diaspora. I mean, there's people from California to Nova Scotia that are of Icelandic descent. And what we're looking at is literary heritage, their books. At the time when they were leaving in the late 19th century, a lot of their books were handwritten. So people would hand copy, just like you see the medieval monks do. They would continue to spread their literature exactly the same way, which is a huge problem for its preservation, because if you have one copy of a book that's mass produced in 1,000 copies, you know, you're pretty sure that the next book and the next book and the next book contain the same thing. But there's this huge risk that if you have people moving in those kind of numbers and they're taking the literary heritage of the country with them, there's just a huge risk that we're losing a lot. And with cultural heritage, you can't just say, hey, we want all these back. So we're developing a digital space where we can digitally reunite manuscripts. So we're doing field work, we're going into people's homes, asking them to share what they have, and then we're creating a digital library with the results.
That's great. So a couple of things jumped to mind. The first, the idea that there was and has been an Icelandic diaspora is compelling, right? And so I think that there are diaspora level conversations that you could be a part. I mean, I'm sure academically there's some interesting comparisons there, and just the notion of a diaspora is one that I think has enough cultural resonance for a lot. That's an interesting aspect of this. I wonder, like Atlas Obscura or like some of the other places that are kind of quasi academic but popular for kind of popular history, that it'd be worthwhile to produce maybe some examples there that you could reach out and see if they would be interested. I could imagine even possibly like a Slate article or something on did you know there was an Icelandic diaspora, and that's sort of an interesting angle to it. Particularly if there's a vivid example. I could imagine, given these are all handwritten, they're probably beautiful texts, I imagine, and so that would be interesting to think visually what this really looks like. And I've had this thought with a couple of the other earlier, but folks that are in a position to have great what we call B-roll for news stories, the kind of video coverage or the visual side, think through what you're sitting on and what you have there, and what you might make available to public media or other that might be interested. You'd have the basis for more pieces for a documentary than maybe some others would, and so that would be useful too. And I don't know if you've thought about producing anything like that, but or getting people that are generations removed, kind of maybe kids today, to go back and read the texts or something like that, or to kind of think about something that would be an interesting event that you could then post online. That would be interesting too. And so there's a lot there. Archivists are often people assume that they're doing this mundane work, and this is really rich treasure trove of work. It's crucial and it's important to, and just the part of what I would tell there. And I'll explain here, Elaine, just a second on the B-roll. There's a question in the chat. I think it's really important to think through some of what might seem like very in the weeds, anecdotal discussions around, like, well, that time when that shipment of books moved from this province to another, and there was an accident in the truck, and some of these things damaged. Those are really fascinating stories. And so, because in that, we almost lost 100 years or this important literary voice because somebody dropped the pizza on it or something, or I'm being facetious, but think if there are those stories, have them ready, because that's going to be interesting to kind of pull out, and I can imagine even just in the level of a community town hall kind of engagement, kind of telling some of those stories and kind of bringing things to life, letting there be a little bit of humor and a little bit of human fallibility in the people stumbling around with these treasures. I think that's important too. And so things that might have been frustrating at the time could actually turn out to be what you get some, exposure for. So I want to answer Elaine's question in terms of B-roll. Sorry. So the notion of B-roll, often journalists, video journalists, will go out and they'll need to have video, pictures or moving footage to cover an interview. They won't necessarily want just a talking head. They'll have spliced in sort of this other imagery. Well, sometimes that just turns out to be people grabbing stock footage or whatever else they're able to get. There's famous stories around like the Reagan administration here in the U.S., for better or worse, was very on top of this and would supply their own B-roll that happened to show Reagan in a very positive light. So even if the story in terms of the audio would be quite negative, he'd win this day on the video. And so similarly here, you might think strategically about how you could actually provide some of that. We did a really interesting interview on the radio show with a woman at the University of Connecticut they're quite interested in changing the story on high weight individuals or folks struggling with obesity. How do we change the language around that? How do we change how we talk about it? Part of what they do is actually put together positive imagery of folks that are of higher body mass and make that available and to try to change, because there's a surprising amount of stigmatization and ridiculous people with heads cut off or other images, and people don't realize that are getting used as kind of stock footage. And so they've tried to subsidize coverage of this by making this available as an archive. And that itself was kind of interesting. But Elaine, that whole B-roll is basically just extra footage that gets used. That's surprisingly real estate that could be powerful for telling your story. But it journalists will grab whatever they have. Sometimes. So if you have some of that prepared and available, sometimes you can actually get it used directly, and you might not be quoted the way you want, but they use the right images, and that's kind of interesting too. So thinking about maybe in your case, Elaine, trying to get some pictures or video of some of these people who have had success stories with their families or with their kids or whatever, and studying or a McMaster logo in the background or something. It would be kind of interesting to kind of have available to share. Okay, great. So let's go to Caitlin. Winia. Caitlin.
Hi. So I'm in the same boat as Kelly, where I wasn't able to attend last week's meeting, but I would love to get your thoughts briefly. So my research, it looks at the connections between public art, specifically public religious art, public dialogues, and perceptions of homelessness. So it's quite an abstract research area. And I'm using a case study of a sculpture. And it's in Hamilton where I'm located, but there's also 6 other replicas in Canada, and they're all over the world now. And it's a sculpture of Jesus who is sleeping on a street bench, and he appears homeless. And so it's started a lot of kind of interesting media dialogues. And I'm looking at those dialogues and speaking to some faith leaders about, why did you get the sculpture? And so far, I've kind of seen what I'm finding in my research, kind of connecting to broader media dialogues on, Black Lives Matter and this growing racial awareness of injustice. So that's been one point of connection. And then another area where I'm thinking about is just broadly in relation to, living in pluralistic, diverse societies and, religious accommodation. And so often religion is used, it can be used to marginalize, but in this case, it's been used to create more social inclusion and even belonging of people who are homeless. So those are just some thoughts, but
that's more than thoughts. So and I know you're just jumping in here, so you can go back and watch the video too. But this is great. Mm-hmm. So there's a couple things. One is I'm going to encourage you to not apologize for your work. And you start the first thing you framed it as, this is pretty abstract. It's not abstract, actually. The concepts you're talking about are quite vivid. And in fact, the examples you're talking about visually lend themselves to really powerful instances where you can imagine depictions of actual people struggling with homelessness and and then the statue and other things like that. I'd be interested here, and I'm gonna, if you don't mind, I'm just put you on the spot just a little bit. It's just to ask the question: why did you get involved in this work? What was the path that led you as a researcher to kind of turn to some of these questions?
Yeah, I think I was really struck by the sculpture myself in particular, and kind of the questions that it brought up for me were, I thought they were well suited to research in a sense.
Yeah. That's great. So, and so I want you to just think about that and have sort of ready in your back pocket, the idea that there are, it could have just been an interesting, idea that you kind of came to. There are 4 or 5 different possibilities, in terms of, your own story connecting or directly resonating it, or your sense that actually you grew up not having experienced this and felt a sense of obligation, and also in terms of your own sense of the role of, religious organizations sort of in this. There's your willingness to kind of put a little bit of a spotlight on your own position, and I'll just note this, but you're in a position of privilege and authority now in terms of being able to comment on this. You're trying to use that partly to put a spotlight on a crucial issue that otherwise we're not going to be talking about, but it's also going to probably be important for you to acknowledge your own role in that. I think there's a way to do that that's really powerful, but I think so that's going to be there. I know if I were interviewing you, I'd be interested. I would have asked that question, right? In terms of, and the way you talk about it is great. I mean, that's something you thought that this was important and, and powerful. And there's some great comments coming in here also on the chat, too, that you can look at. But so just be thinking about that. Be thinking about, in your case, maybe there's an essay, as to, your own sense of, obligation or responsibility as to why we need to pay attention to some of these things. But I also, for better or worse, yours is you probably are writing a lot about, I don't know if you're working on books or, articles, on this, which is going to be rich and powerful. But there's a visual angle to what you're talking about that you probably want to get involved in some projects that are going to build on that visual angle too. And now it's always tricky, and in the work that you're doing, to what extent can you reproduce, say photographs of the statue, and then you're sort of capitalizing on that, but with somebody else's artistry, and it's there's an angle, but it's public, some of this too. So, but you might think about what visually might not be done, because I think that's going to be a way in, because that's the insight that the artist had, originally, as well. And then also from a media content analysis standpoint, it sounds like part of what you're doing is kind of looking at the discourse and how people have talked about it. And that there is surprisingly a story there too, how telling us how we've talked about these things or haven't talked about these things, and that you might be able to, go back to certain media outlets with there too. But yeah, so that there's a lot in that, and thank you. I appreciate you just jumping in and sharing that.
Thank you.
Yep, great. All right, so let's move on to Alexandra, I think.
Thank you.
Yep.
So I am a PhD candidate, and I'm just in the beginnings of my work. Haven't had my thesis proposal yet, so it's all very general, but. So I'm in the French department, and I'm looking to study literary work that interprets historical events in a fictional setting and becomes an instrument for memory, history, and testimony. And I think a particular fictional representation of past personal events of people can help bring empathy to people who lived in the past, but can also help extend this empathy to those living in the present and the future. And now that I've begun learning about mental models, I think literature can also help expand our mental models about various topics and help us understand the perspectives and various truths of different people and events, and extend to the things happening right now in the present and hopefully even the future. And the way this particular author that I'm hoping to study prioritizes empathy and perspective is by sharing these personal experiences of people living in the Soviet and post-Soviet area. And so the historical facts and dates aren't as important as the actual personal experiences of people living during those times. And this helps us think not just of history as just some abstract past, but actual people like us living right now, which hopefully translates to us in the present and the future right now.
Yeah, that's great. So there's a couple angles there. One is just this really interesting challenge that you're facing, this notion of verisimilitude, this notion of fiction being truer than facts, that I'm sure you're used to struggling with philosophically, but it's one that you could be talking to or thinking about how it is and why it is that movies or other things sometimes are more resonant or more relevant to public discourse. And what does that mean about the human brain? And what does that mean about the way that we kind of make sense of ourselves? And is that ethically okay? And I think there's a strong case to be made that it's there's an interesting slight counterfactual or sort of we're worrying an awful lot about misrepresentation, misinformation, all those things these days. But you're actually pointing out that there's some element of this that we're not quite focused in the right way. That that there's an element to storytelling that's about the human condition that's not necessarily about the exact factual nature of that. There's a center. I think the person who's was running it is recently opted to move on, but I think it still exists, called the LePage Center at Villanova University. And it's L-E, capital L-E, capital P-A-G-E. It's the LePage Center for History in the Public Interest that is worthwhile for you to look at potentially if you're interested in coming to the U.S. even as a down the line post PhD, but just looking at what they're doing, with bringing a certain using archival footage, using other ways to kind of help history focus on telling stories about today, and helping us to understand that I think would be really interesting. And you might look at what they've done with some of their projects. I think in your particular case, the more specifically relevant that you can help us understand this circumstance was similar. There's been a lot of that. There's a great example of this going on right now. In a former graduate student of mine, Katie Foss, her last name is Foss. And she has been doing a lot of really interesting work on history of and popular discourse about infectious disease. And so she's been busy, in the last year or so. And I first worked with her. We did some work on historical archiving or content analysis of the ways that breastfeeding was depicted in parenting magazines and popular discourse. She's kind of so she does a lot of work in the health arena, but she has books out and is working on and made a lot of connections between here's surprisingly how we talked about polio. Here's how we talked about the 1918 flu. Here's how and just so happens that resonates quite a bit with now, and the way that we look back and what we remember, what we misremember, what we overlook, what that says about how we ought to be thinking about shaping the narrative now. So she's at Middle Tennessee State University, but it might be interesting to kind of look at some of what she does for, I think, Smithsonian Magazine and some other. She's been in that space of like writing and doing some things, kind of capitalizing on your expertise of knowing these particular eras really well, knowing these authors, but then translating that. So, and feel free to reach out to her, connect to her, and tell her that I sent you. But I think there might be some interesting angles there, too. So great. So I'm going to move on to a couple others, but we can come back here too. But that sounds great.
Thank you so much.
Yeah. Okay. So Gregory, I want to hear more about some of the work you've been doing. We heard a little bit from you last time, but if we can hear a little bit more now, that'd be great.
So I was experimenting, but so what I've pasted are the first couple of paragraphs of a press release of a report that was issued yesterday.
Okay, great.
So I can read it to you, and I kept trying to do the homework, but actually I had people writing my 3 points for me. And so I had a hard time pretending like they weren't. And
yeah,
so,
let's talk about that example, and then it's your struggle with it. Yeah.
So anyway, so that the title of the report is Hotbeds of Infection. You can see in the chat. Mm-hmm. And then the first paragraph describes what this is, which is an analysis of, according to me, the cases of COVID-19 that can be traced to infections in ICE detention facilities. This is the United States, and ICE is the Immigration, Customs and Enforcement. So it's a switch to detaining people as they're basically imprisoning people while their cases for immigration are being heard. And so it preceded Trump, but Trump made it worse.
Right.
The three key findings are: counties with ICE detention centers were more likely to report COVID-19 cases earlier in the pandemic and more likely to confront a serious outbreak. 15 cases, a major outbreak of 250 cases or more, and a healthcare emergency of more than 2,500 cases confirmed in the spring of 2020. Nearby counties to a detention facility were likely to confront a serious COVID-19 outbreak in the spring of 2020. Between May and August, ICE detention facilities were responsible for over 245,000 COVID-19 cases throughout the country, the United States. These cases were concentrated in multi-county economic areas where ICE facilities are located. In the cases linked to ICE, if the cases linked to ICE were the reported caseload of a country, that country would have ranked 16th in the world by total cases, outranking Germany, France, and Canada.
Yeah.
So those are the.
Yeah. So there's a lot. So there's it's interesting. It'll be interesting to see how that gets picked up. I think there's a story there. I think that the whether or not you view it as ICE failing per se, there's some that are going to look at that in terms of thinking about advocacy and comment on and there's a lot to be said about ICE, but even just objectively pointing out that this is a risk, this is a threat, this is something that's driving infection, I think is important. Part of what comes to mind is kind of the headline, more than long-term care facilities, or something that there's we're thinking about this in the context of like the other places that have risen to popular imagination as really driving it. And I think people have overlooked. There's been some talk of this around prisons, but not as much as there should be. But this is you're on. I think you're likely to get some folks that will want to talk about this. The great. Yep. And so that's something that I think continuing to kind of beat that drum is going to be important, but also following up with reporters who specifically have worried about the geography. And also I think something that's going to be important for you is showing a map, that even if it's just something that has highlighted these counties and these areas relative to others would be crucial. So if you can come up with an infographic, you might see that take off. It's something very simple, but that's dramatic. It's able to show that. I think that would be really important. I know we've got just about 10-12 minutes left, so I want to check in with Randy, because I know Randy needed to check away, and then Allison, I actually want to bring you into the conversation too, with some of what you're doing with the new program there. But Randy, did you have anything you wanted to share? If you're still there, you might not be.
I am still here.
Yep.
In there. Sorry, I had to step away for a few minutes. So I'm
no problem.
Randy Jackson. I am leading a rather large multi-year training center grant. We call it the Fee Center for Indigenous STDI Research, with STDIs meaning sexually transmitted and bloodborne infections. And so it's a grant that spans the 4 pillars of health: clinical, epidemiology, basic science, and social science. And we're primarily interested in a few things. The first being, we want to sort of grow the number of scholars who are engaged in STDI research. We want to stimulate collaboration among the 4 disciplines the 4 pillars of health with community. We want to contribute to the development of new scholars in this area, and we want to foster and develop sort of indigenous knowledge translation products and processes. And so we're at the very beginning of this large grant and trying to articulate, I think, sort of the value of it. And the way in which we sold the grant, or the way we decided to get funded, was to focus on the use of indigenous knowledge in STBI research, and particularly the development of innovative methods of gathering data, and also innovative methods for understanding that data all through an indigenous knowledge system.
Great.
We're deeply interested in understanding research impact from within an indigenous knowledge system, and we understand that there are going to be a few challenges related to that, including continuing colonization, what counts as evidence might not be accepted very readily. There's very little in the literature that talks about research impact through an indigenous knowledge system. And and I think that's, I'll just end it right there.
Yeah, no, so that's great. So a really interesting topic and important work. Something that I'd suggest in terms of your framing of it outside of university settings. For better, I deeply care about doing interdisciplinary work. I think it's vital. I also think that in terms of popular imagination, most people don't necessarily see the big deal in terms of connecting different areas. So what you started for administratively in terms of, kind of connecting, what we're doing in the abstract, that's less probably important to lead with than the vital task of kind of centering an indigenous, knowledge perspective, what that might tell us ultimately as kind of a pathway forward for everybody potentially. And also even just in terms of the, the 4 pillars of health, don't assume that people necessarily have that ingrained or know what that is. And that's something that's, within certain circles, people are going to know that, but you might just build up to that, sort of, as you're talking about it. I'm actually curious, whether there is, and Elaine, I appreciate your comment on that too. And so I think the important, if there's an example of a way in which a particular perspective or mindset, actually has led to, huge innovation, that might be an interesting anecdotal example to sort of raise here. You think about there is quite a bit of fascination with, within medical circles, for example, supposedly, a dichotomy between sort of more Western, as it might use that phrase, and more, Eastern, and again, geography is all relative here, but, perspectives, and in terms of medicine. And so that might be something to feature here as a positive step forward, that it's not just crucial that this voice has been left out, that we need to help out, these populations, but rather here's something new and innovative that might actually move us forward. And if you've got an example of that, I think that'd be great. It's also been really striking, something that still sticks with me, just as an example here. I was recently part of a racial equity, conversation as it related to science and health, and something that I continuously am heartbroken over. The more that we think about and learn about the history of our country here in the U.S., but something that was really striking that I hadn't really thought about until recently was the fact that I do work with historically Black universities and colleges here, but that actually, there was formal legislation and formal work that eliminated medical schools that were at historically Black institutions, and so that the state of training is what it is today, not just as a matter of there never having been, but actually the formal elimination of some of those programs. Similarly here, I'm curious about the historical, what could be said about Indigenous, perspectives as either having ever been part of or having been, eliminated from, the conversation. But something about that would be a good way to lead in, that we've been thinking about this now for, decades, and yet we still haven't, formally ever had a person of this background in a leadership position in this, or something like that, to kind of, and that's why we exist. We exist to kind of, change that, equation. So that's great. That's great, Randy. Allison, I just want to give you a chance to kind of talk. I know we have just a couple minutes here, but just the program and for folks that aren't familiar with it, and we can offer maybe a word of advice there too.
Yeah, so I'll give my minute. So SPARC, a Center for Social Research Innovation, is all about bridging the gap between the really deep, messy challenges of society and social research that has the potential to both identify and validate solutions. Social problems don't have large, well-funded R&D staff trying to figure out kind of the newest, best solution. And so despite that, partnerships with academic researchers have really led to real answers to problems that once seemed hopelessly unsolvable. So for instance, homelessness, addiction, juvenile delinquency, to name a few, are areas where highly effective interventions have emerged from the coming together of community-based solutions and then research that help to really both evolve and then elevate what the community solutions were. But to do that well, it really takes professional academic researchers having the bravery, wherewithal, and skills to deeply engage with the complexity of real social problems and put aside a sense of expertise to be humble listeners and active helpers to those on the front lines. On the side of not-for-profits and others seeking to solve social problems, it also takes bravery to subject their work to scrutiny, skill to build their own research chops and be able to try things, test them, and keep learning, and the wherewithal to recognize the immense promise of integrating research into their work. So at SPARC, we try to work with both sides to make these coming together so effective, engaging academic researchers in new methods and fields of inquiry, and working with innovative community organizations on their capacity to do research, and then bringing them together to do research that keeps expanding knowledge about how to fix the problems that those organizations focus on.
So that's great. I am just looking up a link I'm going to send you. I'll probably send it afterwards. But there's a couple of people I want to connect you to. I wonder, and you all are part of this, or all of you that are McMaster folks. I think there's room to put together and be part of, a discussion as to what universities are for. That I think you could sponsor as a provocative way of kind of starting that question, but kind of organizing that. And there's some people that might be interesting to involve. I don't know if you know Kathy Davidson. Do you know that name? Okay, so she's been thinking academically about how to kind of reinvent, institutions of higher education. Has an interesting historical, tale to tell there. I could send you a link to a discussion with her. But it might be worthwhile to see if McMaster could get branded partly as being part of that conversation, kind of going forward on reinvention. But thinking through like what some of the roles that universities have played, historically, because there have been many different ones, and things have kind of congealed now. But in a way that, so this notion of being a convener, of being a forum, that takes a lot of work, to do that, to open your doors, and to be true partners with community organizations. That it's not going to happen just magically. But I think finding creative ways to have that discussion. The challenge for you, Allison, I think, is going to be, for McMaster leadership to be okay with having that discussion. I mean, that's, so, is that all right to have it so provocatively framed? But I think starkly framing it, because I think part of it is going to be, can you have a discussion that folks, I don't know, I'm making this up, but that imagine back, a few decades ago, that there were real serious concerns that were raised on the part of community groups or organizations about McMaster's role in the community or other, and to what extent can this be positioned as kind of a recasting of that relationship and an embrace of not just PR, you're not just but that you really want to do work this way. You want to set faculty agendas on the basis of what community organizations think they ought to be studying, which is fairly radical to say that.
I was going to say that. That's way beyond anything I would ever say.
Well, but if it could you organize a forum where that question gets asked, or where you allow other people provocatively to ask that, and you just happen to be part of that convening, and then to get here's our middle ground. Here's a new center and program that's doing this. I think there's a lot to be done in not only organizing events like this, but wider ones that I think the event space and the talk space, and that's going to be important. If you can kind of be and you might talk with something like this would fit in really well with Aspen, their Ideas Festival, and to think about their education stream, and I might be able to make some connections there too. But and to think about that and that kind of that space, to get this thinking under that heading of what are universities actually for? Why do we bother with them? And that might be interesting. I know we're right at 11. And so my hope was that we would run out of time, because there are all kinds of great ideas, which we've done, and that there's a lot more that we could probably talk about. I think these are great. Are on the basis of, there's a lot that could be picked up further than the journal articles that you're publishing. And so I think that I hope to see a lot of that happen. And certainly feel free to connect further with me. Allison, I don't know if administratively you and Cheryl have anything else to do to wrap up here. I'll just turn it back over to you.
No, just, we are here to help. I was just mentioning to Gregory, it's not well known because we're new, but we do 4 hours of free conversation with any researcher at MAC around your work and how to, any aspect of it, from research design and analysis through to knowledge mobilization. So if we can be helpful, if I can be helpful, please don't hesitate to reach out.
If you need to go, you go ahead, and it's nice to virtually connect with you all. I appreciate the opportunity, and I know it's a lot to pack into 90 more minutes, but I appreciate everybody's patience. I appreciate people stepping up and talking about their work. It's not easy to do.